Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. Now in this video, we are going to see about hypo and hyperthermia. So these hypo and hyperthermia, it will also come under thermal injuries, but we are seeing it separately because sometimes it can be asked as a 2 mark or something, and MCQs can also be asked in this topic. This hypothermia we are starting with. So first, the definition of hypothermia. So when do we say something as a hypothermia is when the core temperature of our body falls below 35 degrees Celsius, we call it as hypothermia. So not the general temperature, your body's core temperature. When it falls below 35 degrees Celsius, we call it as hypothermia. Now when it goes to 32 degrees Celsius, shivering, which is a protective mechanism. So you will shiver and your muscle will shiver, it will lead to production of energy, right? There will be heat. So that shivering mechanism, it will stop. Once the body temperature reaches 32 degrees Celsius, shivering will also stop. And if it goes on decreasing by 30 degree, like whatever mechanism your body will use, the thermoregulation mechanism that we use will be fail. So there will be failure of thermoregulatory mechanism. So what your body do? It will try to constrict the capillaries in the peripheries. So thereby it will prevent escaping of heat from your body, and there will be dilatation of the vascular channels in the core organs. That thermoregulation will be completely lost. Everything will go into sudden vasodilation. And by 26 degrees Celsius, when your body temperature reaches 26 degrees Celsius, there will be coma and death. So hypothermia, when the body core temperature goes below 35 degrees Celsius, we call it hypothermia. By 32 degrees Celsius, there will not be any shivering. Shivering will completely stop. And if it goes below to 30, there will be failure of thermoregulatory mechanism. And by 26 degrees Celsius, the body will go into coma and essentially death. So this is how hypothermia works. And in hypothermia, you will be getting to see certain injuries due to the cold. So those injuries, it is divided into injury with freezing, and you will get injury with freezing and injury without freezing. There will be injury without freezing also. So what are the injuries that you will be getting in this cold condition? So first is this. You will have frostbite. So what will happen in this frostbite? So there will be formation of ice crystal. Formation of ice inside the tissue. Because of that, you will essentially lose the limb. So it will happen mostly in the extremities, like your fingers and toes. It will start as an area of redness. It will become a blister like thing. And later on it will progress and you will essentially cut off all the circulation and it will become gangrenous. So this is the frostbite. It will become darker and it will become gangrenous. Okay. Gangrene will form and it will be dark. This is how with tissue freezing it looks like. If there is no tissue freezing, that is when the temperature is between 2 to 5 degrees Celsius, like the temperature is really low, but it is not freezing, not sub-zero. So under that conditions, you will get something like this. This is known as trench foot. So here what happens is that you will have moisture along with the cold. Because of that, everything, your extremities, whichever is coming in contact with that moisture, it will become like this. It will like shrivel. It will look like a washerwoman's feet. Because of this immersion, it will look like washerwoman feet. And there is more chance for infection also, especially if the water is dirty. The area is so dirty, you can get infected also. Sometimes what you will get is, you will get something like this. You get acral ulcers. This can also happen when the temperature is really low. You will get these inflammation on toes. So this can also happen in this very low temperature. So hypothermia with tissue freezing, you will get these frostbite. Without tissue freezing, you can get this acral ulcer or if the water is really dirty, you will get these trench foot and infection. So this is about the injuries that you can get in hypothermia. And if a patient dies, like because of hypothermia, if somebody dies, what are the post-mortem appearances that you can expect to see in them? So first, the crime scene. So how they will look like is this. They will have paradoxical undressing. So paradoxical undressing is like ideally they are in a hypothermia. So they should be feeling much colder and they should try to cover themselves. They should be having multiple dresses, but how you will be finding the body is there will not be any dress, they will be naked. This is known as paradoxical undressing. And why this is happening is that because of the failure of thermoregulation, they will feel this false sense of heat. Because of that, they will be extremely hot. Because of the thermoregulation failure, they will feel this extreme hotness. They will remove all their dress and they will be found naked in the woods. So this is how you will be finding them, and this phenomenon is known as paradoxical undressing. Next, you will see something known as hide and die. Hide and die syndrome. So here what will happen is that you will be finding the body deep inside, like inside some shelter, like under furniture, like that you will be find the body hidden. Body will be hidden somewhere. And if you find these, like you find a hidden body somewhere with naked body, what you will think? You will generally think like somebody has tried to do something to them and they have killed them. Like that only we will be thinking. But actually it is nothing like that. They will try to hide from the cold. So they will try to look for some shelter where they can escape from the cold. So that is how you will be finding the body. That is hide and die syndrome. And if there is complete failure of thermoregulation, they will remove all the dresses because of this false sense of hotness. That is called as paradoxical undressing. And these two, it is very common in hypothermia death. Apart from that, there is one more thing that is common with hypothermia death is this. You will see this Wischnewski spot in stomach mucosa. Basically, these are nothing but erosions. See these dark spot that you are seeing in the stomach mucosa. This is Wischnewski spot. This is also seen in hypothermia death. Apart from that, you can also see pink color hypostasis. There will be pink color hypostasis and the blood will also be pink. This is due to the because of the reduced temperature, oxygen will not be able to be separated. So you will have oxyhemoglobin present all over the body and you will get this typical pink color appearances. So these are the most common features that you can expect to see in a death by hypothermia. So first definition of hypothermia, that is below 35 degrees Celsius. And what are the phenomena that you can see? With tissue freezing you can see frostbite, without freezing you can see trench foot and this acral ulcers, and finally in death you can see paradoxical undressing, hide and die syndrome and this Wischnewski spot. So these are very important things that you can get to see in hypothermia. Now what we are going to see is hyperthermia. Hyperthermia is what we are going to see now. So in hyperthermia, you get to see certain conditions. First is heat cramp. Next is heat exhaustion. Then you can get heat stroke and heat syncope. So you can get to see all these conditions in hyperthermia. So basically what happens here is that when there is excess heat, there will be lot of sweating, right? Because of heat you will sweat, and through this sweat you will lose both water and salt. So water plus salt both are lost. So if you are sweating, if you are in a hot temperature, you will keep on drinking water. So you will replace water. You will be replacing water, but salt you will not replace. Because of this reduced salt, you will be getting cramps. Muscular cramps you will be getting. That is heat cramp. So basically you will lose both salt and water, but you will simply replace water and loss of the salt will be still there, and because of that you will be getting muscular cramps. This is commonly seen with people who are working in hot fields like mines and people who are working in construction under hot temperature. So all these people, they are more prone to get this heat cramps. Next is heat syncope. Here what will happen is that here the people, this is usually more common among people who are not used to heat. Like sometimes if people from colder countries, they are coming and visiting some tropical countries, what will happen? They will be suddenly exposed to the hot temperature. So if they are not used to this hot temperature, when they suddenly get used to this temperature, what will happen is that there will be sudden vasodilation. So all the blood vessel will dilate and all the blood will pool in the periphery. There will not be enough blood supply to the vital organs. Because of that reduced blood supply, they will get syncope. So this is heat syncope. This is mostly seen in people who are not used to these hot temperatures. So this is heat cramp and heat syncope. Now you have something known as heat exhaustion. So what heat exhaustion is? So the same thing, there will be water and salt loss. So you will be losing water and salt, and if it keeps on happening, if you don't replace it, you will be starting to experience like dullness, fatigue and sleep. So you will feel very exhausted. This is the initial part. You will not replace salt or water. You will keep on losing water and salt. Because of that, you will start to feel the general malaise. You will be exhausted, and if keeps on happening, if it keeps on happening and if you don't intervene, you will end up with heat stroke. So heat stroke you will be getting. So what is heat stroke? Heat stroke is there will be complete loss of water and salt, and it will not be replaced, and there will be thermoregulation failure. You will get thermoregulation failure, and there will be loss of sweating, and you will end up having CNS depression. So this is what basically happening in heat stroke. When there is continuous loss of water and salt and you don't replace it, what will happen is that your sweating will stop, your thermoregulation will stop, you will be completely exhausted, and it will start affecting your brain. Your CNS system will completely shut off and you will experience coma and death. And in the postmortem, you can expect to see Purkinje degeneration. In the postmortem period, in the cerebellum, you can see degeneration of Purkinje layer in the cerebellum. This is the most typical feature that you can see in heat stroke. This is very typical in heat stroke. So, hyperthermia, as long as you are replacing water and salt, there is no issue. When you don't replace it, if there is continuous loss, you will end up with this heat stroke where the thermoregulation is completely failed and there will be absence of sweating. Also, you will experience postmortem caloricity. That is, there will be hyperthermia and the body's temperature will remain elevated even after death. There will not be any postmortem cooling of the body. This is hyperthermia. So, we have seen hypothermia, we have seen hyperthermia. So, this is all about hypo and hyperthermia. Hypothermia, you have to remember hide and die syndrome, paradoxical undressing, and in hyperthermia, you have to remember this heat stroke. So, thank you for watching. Thank you.